Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 113,911 confirmed cases of COVID-19 in Canada and 38,680 cases in Ontario. Chatham-Kent has 219 cases, and Sarnia-Lambton has reported 295 cases. Michigan now has 78,019 cases, with 12,425 cases being in Detroit. Today, we are reporting 2,221 cases of COVID-19 in our community, an increase of 41 cases from yesterday. 25 are workers in the agri-farm sector, 14 cases are in the community, and 1 case is still being investigated. 1,433 people have now resolved, 664 people are self-isolating, and 15 people are in the hospital. 26% of our overall cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male, and 34% are female, with 1% unknown at this time. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care and retirement homes in COVID outbreak. In addition, there are 11 workplace outbreaks. 6 are in the agriculture sector and 5 in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. On July 22nd, the provincial government updated its guidance and requirements for retirement homes. This updated guidance specific to visitors to retirement home has key changes from the previous version that was released on June the 10th. Some of these changes include removal of the visitor testing requirement, added guidance regarding the resumption of personal care services such as hairdressing, access to barber services, clarity regarding home tours for potential residents and new admissions, clarity regarding self-isolation for new admissions. These changes are in place for every region in Ontario, regardless of the stage. In order to implement the visitor policy, a retirement home must not be in any outbreak. Any home in outbreak is supposed to restrict visitors. The home must have procedures in place that focus on the safety and ensure proper infection prevention and control measures are in place. Non-essential visitors must meet the following requirement. This includes prospective residents touring the facility, includes past active surveillance at each visit. Visitors no longer have to attest verbally or written to a negative COVID-19 test to visit a resident indoor or outdoor. They have to wear a face covering mask at all times if the visit is outdoors, If the visit is indoors, wear a surgical procedure mask at all times. The visitors must be educated and follow all required protocols for health and safety and only visit in designated visiting areas that are established by the home. Residents are able to take short absences away from the home for shopping, visiting families, etc., as long as they meet and follow the following requirements. They have to pass the active screening. They have to wear a face covering mask while outside the home and must adhere to all protocols for short absences. This is good news for residents of retirement homes and their families. It is important that all appropriate precautions are taken. Seniors are at increased risk from COVID-19. Visitors should maintain physical distancing and wear their face covering properly, ensuring that the entire nose and mouth are covered. Please do not remove your face covering at any time during your visit to the retirement home. To protect our loved ones and those most vulnerable to COVID-19, we all must do our part to keep them safe by following public health recommendations and requirements. Review the full document, Reopening Retirement Home, updated July 22nd. Please visit our website, www.wechu.org. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Yes, good morning, Dr. Ahmed. I know we spoke a little bit about this over the last couple of weeks, but I was hoping to get an update about some of the migrant workers who are still in isolation. We were hearing reports that some that had tested positive at a hotel, it's still some have symptoms and are awaiting test results. So I'm wondering who is responsible for monitoring those individuals who are self-isolating at hotels?
So there are a couple of components to it. Obviously, any type of public health follow-up is being done by public health and in EMS. In addition, the Canadian Red Cross are the agency that is at these hotels, monitoring and taking care of all the individuals for their other needs. We have also now on the ground emergency management action team from the province that's also down there as well to provide some of that clinical care that these individuals are need. So a combination of all of those agencies are working together to make sure that all the needs of these workers are met, and any appropriate concern is taken up by the agencies that are in the best position to address it. And we are as we are developing protocols, I think it's getting much easier to provide that support to everyone that needs it.
And part of the Section 22 order that you had issued quite a while ago now, it is up to owners and operators to provide healthy meals for these individuals. Does that still count if they are self-isolating in hotels, or would it be these agency partners that are providing food?
So at this point, when they are in the hotel, I think mainly it's the responsibility of the partners that are overseeing all of these work. And in the beginning, there has been some conversations to ensure that the appropriate food is what does appropriate food means, culturally appropriate, and then ensuring that we have the list and all the information that is needed to provide that food support to all these workers. So there were some exchange of information, but overall, right now, if anyone who is at the hotel, it's primarily the overseeing agency, which is Canadian Red Cross at this time, that is responsible for taking care of all the food and meal requirement for these workers, and not necessarily the employer. But sometimes these dialogues are ongoing, and that happens. But primarily, it's the Canadian Red Cross who's providing that care.
Thank you so much.
Any questions from Blackburn?
Yes, I forgive me if these have been asked before. I'm standing in for Maureen today. Can you confirm 2 cases at 2 separate stores at Devonshire Mall?
So we do have a couple of cases we always investigate all these workplaces and anyone who is working at these workplaces. We do look at that and we investigate all of that. And if there is any concern that these cases are linked together, when I'm saying linked together, that means if they are, if we have a reason to believe that the cases are acquired or transmission happened at the workplace, we do issue that advisories. Right now, I don't have any particular workplace to report, but we do get all these information and are currently being investigated.
So are you currently investigating these two cases at Devonshire Mall or no?
All I can say is we're investigating other workplaces as well. I cannot specifically mention any name at this time.
Okay. I guess why not release the names of these businesses with these cases? I know that that's one piece of information that the public really does seem to hunger for.
Well, I guess we'll have to go back to the utility and use of that information. I don't want to create a sense of concern when there is none. And I also don't want to overemphasize that if that's the only place that you should be concerned about and not the rest of the places. So, and as we know that more and more businesses are opening up right now, anyone who got COVID positive, they will be working somewhere. That doesn't necessarily mean that the workplace itself is at risk. It only means that they happen to work there. So I think that's why it is important to make that distinction. And when for someone who is out in any of these malls or commercial establishments and everywhere else, I would request them to take precautions, presuming that anyone they're coming in contact with could be a COVID positive patient. So I think just ensuring that you know about one particular place that had a COVID positive person, and now people are concerned that maybe if I'm going to that particular business establishment or particularly that's where the risk is, it doesn't mean that. And I just worry that if we start to give that impression that one place is better than the other, it would lead to people not following the precautions that they should. Like I would, in any business establishment that I would go, I would presume anyone who is working there could be a positive, and I will take all the appropriate precautions, including wearing my mask, including washing my hands frequently, including maintaining my physical distancing. So all of these measures need to be followed up every time. And when we are talking about reporting those workplaces is to provide that information that if there are any, let's say someone was not wearing a mask, or if someone was there and if the transmission or if they are infectious and they work, they put other people at risk. And from a notification perspective, yes, that would be the trigger where we can say that, yes, we'll issue that information. But again, recognizing that a lot of the time we want to share that information, but we want to share the information that is more factual and accurate. And as soon as we establish that the person worked at any of these workplaces while they were infectious, then there will be a consideration to issue that information and release that information to the broader public to take appropriate precaution as needed.
Thank you.
Any questions from AM 800?
I have two for Dr. Ahmed, but just clarification first from Teresa. Teresa, can you break down the numbers again for us for the 40?
Could you repeat that, Rob? What numbers?
The 41 confirmed cases for today. Can Teresa break down those numbers for us again? I didn't get them all. Okay.
So of the 41 cases, 25 are workers in the agri-farm sector, 14 cases are in the community, and 1 case is still being investigated.
Okay, thank you. For Dr. Ahmed, I guess going to Blackburn's question, would it be safe to maybe release the manufacturing and agri-food sectors that are considering outbreaks? Let the community know where those businesses are?
Are you talking specifically about the farms that are currently have cases? Is that what you're referring to?
Yeah, like the names of these businesses, like manufacturing could be a number of businesses in our area. Is it? I guess maybe for the public, like Blackburn was saying, like there's a lot of people asking where are these outbreaks happening. Wouldn't it be, I guess just for the community, shouldn't we release those names?
So Rob, again, balancing the need for the information, I guess it goes back to some of the need that people want to know if my neighbor has COVID positive or not, if someone else has COVID positive or not, or which businesses are that. I think we have to understand the utility of this information, that how is this information going to help someone without jeopardizing the privacy and confidentiality of every individual in our community. So having said that, even the same goes for the businesses as well. So if any of these businesses, as you're referring to, the manufacturing or other places, if they are serving clients and if they are under outbreak, then yes, there is that risk to the community, and putting that information out there is critical for contact tracing, or even maybe identifying people who could be at risk. And those individuals can go and get themselves tested or monitor their symptoms and whatnot. But for those businesses or those factories or farms where a general public would never go, then what is the information, or what is the public health benefit we are getting by having all those breaching those confidentiality and sharing those names? So I think there has to be some justification, some rationale, instead of just putting out that information out of not caring for any personal health information or privacy of any individuals or businesses.
So if I'm heading to one of these manufacturing plants, do they, and I'm dealing with them, do they have to let me know they're under an outbreak before I go into the facility?
Well, if you are going inside the facility, I think that's where they have to make sure that you are not putting yourself at risk. And if these businesses are open for any type of individuals coming into their facility, they should have some process in place to ensure that the safety of the individuals are maintained, and they're not putting anyone at risk.
Thank you.
Any questions from the Windsor Star?
Yes, good morning. Doctor, is mass testing happening now on area farms?
Well, it started with some of the farms that are currently in an outbreak situation. So we had some progress through Ontario Health. They are supporting some of these testing at these farms. But I guess a broader strategy to test all these farms are still on the table. But right now, as we know, it's voluntary. We've heard from the Premier's office as well that they're looking into all the constitutionality and legality of it to make it mandatory. So some of these conversations are happening. But as we know right now, the testing is back on, the surveillance testing, and farms are signing up for that to get their staff tested.
And on the topic of the Premier talking about mandatory testing, what are your thoughts on that? Legality aside, I know they still have to look into it, but what are your thoughts about making it mandatory?
Well, what we are looking for right now is an industry that is heavily hit by COVID, and the congregate living setting is also making it more challenging to contain the virus once it starts to spread. So in addition to everything else, all the public health measures that we have, I think it is important that these workplaces get a good handle on what is the current situation right now with the number of people who could have mild infection, or maybe are currently symptomatic or currently infectious at this time. So having a good understanding of those individuals, those workers, can help prevent any other further spread in the community. Some of the farms that were tested as part of the mass surveillance testing did not show any positive results. But on the other hand, there are farms, when they were tested, they had a number of cases. So I think knowing what we know right now, it would be in the best interest for all these farms to get their workers tested, to know exactly what the situation looks like within their farms, and to prevent any further spread inside the farm.
And about the increase in manufacturing facilities that are experiencing outbreaks, what are we seeing there? Are people going to work sick?
Well, I think it's sometimes it's hard to establish when we are trying to make that establishment because everyone who is now positive, like back in the days, like a couple of months ago, no, like very few people working, only essential workers, frontline staff were working, and a significant majority of the people are just staying home, maintaining their physical distancing with everyone else. With the reopening of the province, with the reopening of the economic activities, anyone who is positive, potentially they will be working in somewhere. So that's the bottom line for where we are seeing all of these cases. But on the other hand, I think it is important. That's why we put out all those toolkit out there for employers to have good, strong policies and procedures in place to screen their workers before they come to work. And while they're working, they have to ensure that they are maintaining all those physical distancing, they are maintaining all their PPE requirements and everything to ensure that they're not putting their workers at risk. So all of those guidance documents we created for all these workplaces, and as we are seeing these cases, we want to make sure that we review all that information. We make sure that every workplace is doing what they should do to prevent their workers from contracting COVID-19 in the first place. And if someone is positive, what are some of the steps that they need to do to ensure the safety and well-being of the rest of the worker and prevent any transmission. So it is important that we get that message out there. We want to make sure that the people are using the resources that we have created. We are available especially for businesses, large businesses, with any of their questions if they have to keep their employees and keep their workplaces safe. So we've got tons of resources. I think it's just a matter of time to make sure that the workplaces and the employers are looking at those resources and following those guidelines to protect their workers.
Thank you.
Any questions from CTV?
Yes, question for Dr. Ahmed. Wajid, the migrant workers that are staying in the hotel, you had talked about how Red Cross is helping to manage there. We've understood that there's some concern that the workers who have come out of a 14-day quarantine aren't then being retested. Has that been addressed, or is that the case, or are they getting retested before they go back out into their congregate living setting or going back to work?
So when we're talking about a clearance test, clearance testing is not required at this time because we know based on the science that an individual can continue to be positive for up to 90 days or longer. So there is no requirement for them to have a clearance test. There's good evidence to suggest that after 8 to 10 days, most individuals will clear the infection and will no longer be infectious. So 14 days is something that we are using in the province of Ontario, just extending that safety blanket and ensure that after 14 days, the likelihood of someone being infectious practically goes down to zero. And then from the positivity perspective, individuals can still come back to be positive after 15 days, 20 days, 25 days, up to 90 days, which makes it much more challenging to use a read swab for clearance purposes. Some individuals may show a negative follow-up, but a large number of them will continue to be positive, but that doesn't mean that they're infectious. So that's why the province is not using that as a clearance tool for these workers or anywhere else.
And just to build on that, obviously the agri-farm sector has been kind of one of the big areas of focus in our region. I think you've said previously that you feel more comfortable in terms of the handle on the outbreaks in that area. Now we've seen maybe a slight spike in the number of community cases. How are you feeling overall in terms of our managing of this crisis moving forward? And are you anticipating an outbreak in another sector that will require a complete pivot of resources?
Well, I guess that's where we're trying to work with all these sectors, especially the community, risk to the community, because any farms, any industry that we are looking at, there are people who live in the community and also work in that sector. Ensuring that there is no spillover effect in the community or into any other workplaces is a critical component of this stage of the pandemic. And we're not alone in that particular situation. Any of the location where they have more industries, more workplaces, they are seeing this type of outbreak. So it is important that we keep a close eye on it, and we work with them. One of the challenges that what we are seeing with the agri-farm sector is, we talk more about the temporary foreign workers, we talk about the migrant workers, but we also have to recognize that as a sector itself, they have people who work and live in the community as well. So they need to be, when we are talking about the sector in general, any farm, any place, it includes local as well as the temporary foreign workers. So it's not just one particular group that we are concerned about. We are concerned about everyone. So the risk is high, obviously, for the temporary foreign workers because of their congregate living settings. But if physical distancing is not maintained, and if local and the temporary foreign workers are working together in close proximity without having any precautions, there is this potential that they can spread it to one another, and then it can cause more challenges. So we are doing our part to make sure that the message is very clear, that it's not just the temporary foreign workers that we are concerned about. We're concerned about everyone.
And so is the health unit comfortable with the process in place as it stands, or is mandatory testing required in order to put a lid on this, to, like you say, avoid any further spillover from agri-farm community spread into other sectors?
So good question, and I think what we are working with is again, not all farm are the same, and not all employer are the same to work with. We have got some challenges with some farms with getting the information or working with them, and then we have got some farms which we didn't have any challenges and everything worked fine. Knowing what we know here right now, and it seems like the number of cases in many of these farms is continuing to rise, and definitely it just raises more concerns in terms of the current measures that are in place. There's one thing that you have a good, strong plan that you put in place, but how effectively that plan is implemented. Public health or even the Ministry of Labor cannot be at the farm or cannot be at the workplace at all time. And that's why it is important that through the engineering control, through administrative control, all these workplaces should do everything to prevent any spread within their workforce and within their community. At this point, given what we know and given the widespread spread of COVID-19 in these farm workers, I would strongly feel that everyone should get tested at these farms because we can prevent many of these spread in these farms if we know exactly if any of these farms have active cases. We can put a lid to it. We can stop that further spread. But if we are not testing these people proactively, I think there will be some challenges that will make life difficult. And again, going back to some of the conversation, testing will tell us what we need to take care of, but it does not replace all the other important measures that has to be in place at all times, which include physical distancing, PPE use, and staying home when they're sick. So we have to focus on the strategy in its entirety, and testing is definitely something that we feel that it is important. And especially with what is happening right now, I think a push to get the testing done is definitely something that we'd like to see.
All righty, thank you.
Any questions from Windsor?
Good morning, Dr. Ahmed. Last week, Windsor Regional reported they had a record number of people going to the assessment center for testing. Do you think that's contributed in any way to any increase in the delay time it takes to receive tests back?
So good question. I think last time when we got we used to get we get this data from Public Health Ontario with the testing timeline and everything. So we do have that information available. And we have not seen a significant delay, but I could be wrong, and maybe this week could prove me wrong. So we'll be looking at the data and what we understand, and maybe Teresa can comment on it. The lab definitely have increased the capacity. Our local lab in London that's serving Windsor-Essex, they do have that additional capacity that they're using to test our specimens. And we'll have to wait and see how it impacts overall.
So it's relatively, is it 24 to 48 hours still basically to receive test results?
Most of the symptomatic individuals are receiving their test results back within 48 hours, so I can say that. But I think in some cases it's longer. But I think it's just a function of how many tests are being conducted locally and what are the priorities. I cannot say that every test is returning within 48 hours, but majority of them, especially the symptomatic people, their test results are getting back quickly.
Okay, thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
I just wanted to ask you, Dr. Wajid, if you are concerned about schools reopening in the fall, considering we do not yet have a plan from our government.
Well, I know that the province is working on a plan, and our medical officers of health across the region are also wanting to have a look at the plan, what the provincial plan look like, and to provide our input with respect to the safety of our children attending school. So what my understanding is, we will see some plan in the early weeks of August, and that would provide us, give us some opportunity to look at it and give our feedback to the province as well.
That's a pretty quick turnaround, though, considering school will start in September.
Well, the schools are already working on their own planning pieces already, so it's already being worked at, but we'll be looking at it, what the plan looks like from the province.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed, on Friday, Premier Ford said he wasn't releasing any stage 3 details today, said health officials want to analyze the numbers more. Was it you and your team? Did you ask for some more time as well?
Well, I think it's the provincial decision to begin with, but we did ask the province to look at some of the consideration into other areas that are contributing to the spread, especially in stage 3 or even in other countries and jurisdiction that has gone past the stage 3 or similar to stage 3 direction. And what are some of the learning that we can use in Ontario? So some of these considerations are currently being looked at.
And then finally, the first case of COVID in Canada was identified 6 months ago. I guess overall here in Windsor-Essex, how would you grade us, how we've been handling the pandemic?
So that's overall in Canada as a country, I think we have done an amazing job. And even in the province side, we have done a great job in containing the spread of the disease. Even locally, I think we have done an excellent job. Our community has really worked together to follow all those public health measures. Having said that, being proximity right next to US, and especially one of the hotspots that was identified based on the data, and some of the unique challenges that we have with the agri-farm sector, with the large number of people living in congregate settings, are higher than provincial average of seniors in our community, our daily commuters. I think we have still done a pretty good job. I think we have definitely learned many things during this pandemic, and the congregate living settings, the agri-farm workers. I think that's definitely will challenged us a lot, and will continue to challenge us in the next couple of months. But we are hopeful that with all the support and support from the community, we should be able to get a better handle on that.
Thank you. Have a good day.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
CTV? Windsorite?
No, thanks.
Thank you, everyone.
Thank you.
Thanks.
Thank you. Take care.